Hello, my dear health conscious ladies. I'm Dr. Sylvia, a general practitioner and health educator with Askawayhealth. Welcome to another one of my videos where I teach you all about the emergency birth control pill. If you want to know why your period may be delayed a little bit longer than usual after using the emergency birth control pill, make sure you watch this short video all the way to the end. If you find this kind of health information videos helpful, don't forget to give it a like and subscribe to our channel. Click the notification bell so you know every time we publish new videos just like this. Of course, the first reason you will think about when your period doesn't come at the expected time after you've taken the emergency birth control pill is that you're pregnant. And while this is a reasonable suspicion, it is not the topic for this video. Please remember that if you have taken the birth control pill and your period is delayed by more than 7 days from its expected date, or it seems a little bit lighter than usual, please do a pregnancy test. If you're interested in learning the circumstances where the emergency birth control pill may not work, make sure you check out this video here where I share a lot more about that subject. Today, we will consider what happens when you've not had your period more than 1 week from its expected date and you have recently taken the emergency birth control pill. You've done several home pregnancy tests. You've even popped along to see your doctor and you've had blood pregnancy tests and they've all come back negative. So you're not pregnant. And as you're well in yourself and there's nothing else obviously wrong, your doctor asks you to go away and watch for a few weeks and pop back to see them if the period still hasn't appeared. But where is it? Why is the period delayed? Could something else be going on? Reason number 1, the pill side effect. The emergency contraceptive pill can have a number of different effects on a menstrual cycle. In most women, after taking the emergency birth control pill, their periods arrive about the same time as when they expected it to. However, for some ladies, the period may come a little bit earlier, and it comes a little later than expected in another group of women. In fact, according to some studies, in about 10% of women, the period could be delayed by more than 7 days. And so, while it may be stressful to experience, it may be that you're one of those ladies whose period is being delayed by the side effect of the pill and not because you're pregnant. Therefore, there is no need to panic. Instead, do a pregnancy test to keep track from 2 to 3 weeks after you had the emergency birth control pill. So the message is, expect some changes to your periods after using the emergency birth control pill, which should settle after some time. The second reason happens from using several emergency birth control pills during the same cycle. Now ladies, the emergency birth control pill is meant for occasional use and not as a regular method of birth control. Ideally, the recommendation is not to use it more than once in a menstrual cycle and not to get into the habit of using it every month on a regular basis. However, some ladies find themselves using the emergency birth control pill more than once or twice in the same cycle, and this can lead to irregular periods, including a delay in your expected period. Well, consider a regular form of contraception that suits you and a method that you can stick to instead of using emergency birth control pills in a haphazard manner that is only going to lead to irregular menstrual cycles. And yes, while we know that taking more than 1 or 2 of the birth control pills than is recommended does not cause death or significant harm according to the manufacturers, not knowing what is going on with your periods can be incredibly distressing for some ladies. Number 3, this is more a consideration and there's not really much evidence for it. But Could the time in your cycle when you take the pill have an effect on delaying your periods? Some studies suggest that the earlier in your cycle that you take the emergency birth control pill, then your next period will come earlier. They also say that if you take the pill later on in that particular cycle, you may have a longer period of bleeding when the next period arrives. But so far, no link has been made between when you take the pill to any future delay in your period. Number 4, consider other possible causes outside of the pill. If your period delay is going on for longer than 8 weeks and you still have negative pregnancy tests, then you should have a chat with your doctor. When a woman who used to have regular menstrual flow has not seen her period for 3 months in a row, this is known as secondary amenorrhoea. Your doctor may have to consider other possible reasons, for example, weight changes, stress, any other medications that you're taking, abnormal hormone conditions like polycystic ovarian syndrome or thyroid disease, and even abnormalities with the reproductive organs like the womb. So these are some of the reasons that your period may be delayed longer than usual after taking the emergency contraceptive pill that are not related to pregnancy. But by far the most common reason in women who have this experience and are not pregnant is the pill side effect. Thank you so much for watching. Please give this video a thumbs up if you found this helpful. And in the comment section below, please tell me what your emergency birth control pill experience has been in terms of delayed periods. Also, if there's any question that you'd like me to cover in a future video around this topic, then please drop a suggestion in the comment section as well. Next time, I'll be looking at the different types of vaginal bleeding that can happen in pregnancy. If this is a topic that you're interested or curious about, make sure you've subscribed and click the notification bell so you know when that video goes live. And while you're waiting for that to come through, check out these two here and I'll see you again soon. Stay healthy.